Hi, my name is Jessica Espinoza, and I am a workforce development strategist working with the Training Fund, primarily in Rhode Island with Women and Infants Hospital.
And my name is Lisa Morris, and I'm from UMass Medical School, and I've been brought in to Care New England and the workforce development team to help roll out an interpreter program with an apprenticeship.
We really were focusing on women and infants, primarily because there are about 108 incumbent healthcare workers that are typically being pulled from their shift to follow a patient to serve in an interpreting role. At the same time, the hospital is paying high-cost agency for medical interpretation, regardless of whether a patient shows up or not. So these are different data sets that we're currently in the process of compiling to do a data analysis to find out how much time is being spent away from a shift in order to be able to provide interpretive services, as well as what are the actual costs that the hospital is expending in terms of medical interpreting agency fees. Both the union and the hospital have identified some shared goals, really to make sure that patients with limited English proficiency are able to deliver interpretive services in a way that meets state and federal requirements, as well as building an infrastructure to allow for real-time dispatching of interpretive services. So in this process, we found that there's a lot of confusion around interpreting and translating versus certified versus qualified. We did do a national search to work with an educational provider, and we really felt confident about working with UMass Medical School and Lisa Morris in particular, because a lot of curriculum has already been developed. In order to be qualified, Lisa, perhaps you can explain.
Sure. So in order to be qualified, one needs to at least have gone through a full medical interpreter training program of a minimum of 40 plus hours. The training program we have developed at UMass is actually 60 hours, and it incorporates interpreter skills, medical anatomy and physiology, so learning the body systems, as well as learning the actual terminology in the language of the bilingual incumbent worker. For the purposes of women and infants, we have chosen to start with the largest pool, which actually sees, in terms of demographics, the largest patient pool, which is Spanish patients. So we had a pool, as Jessica mentioned, of 108, and our first part of the project was to go in and assess these individuals for their bilingual ability in Spanish. From that assessment, now we are beginning a training for those that have passed and are considered to go forward to be qualified. Once they've been qualified, then they can be part of the apprenticeship to then further their education and interpretation skills on the job, to lead to certification, which is done by 2 national organizations, and one needs to have a minimum of 45 plus hours of training, as well as 1 year of job experience before sitting for a certification exam, which is written and oral.
Correct. So that's a distinction between the qualified versus the certified interpreter. We found that it really fits, to become certified, it really fits into an apprenticeship model quite nicely. So like Lisa mentioned, we went through a round of pre-assessments. Out of the 108 individuals, we've already pre-assessed about 50 of them. Perhaps 15 or so did not meet that baseline combined score of 75 between written and oral. So UMass Medical School is going to be developing a preparatory course to get our folks that aren't quite at that 75% to where they need to be in order to then be able to take that medical interpreting training. Again, that component right here of the medical interpreting training, the 60 hours, gets folks to a place where they're qualified and they meet the federal and state guidelines. To get to certification, we also found UMass Medical School currently has curriculum developed for behavioral health, which is a factor that we're seeing in pretty much every setting, as well as the written and the oral certification exam. There's also a train the trainer component, and we would be able to hold the curriculum and in the future be able to conduct pre-assessments and post-assessments. So the neat part about this project is that although there's grant funding in the beginning to get folks up to 48 incumbent healthcare workers potentially to be certified, It's really built to be a self-sustaining model that would then allow these individuals to play a mentoring role to be able to have incoming bilingual healthcare workers meet that qualification interpreting level.